Hello everyone, my name is Bianca Rico. I have prepared a short presentation for my leadership conference. It is about evidence-based practice and horizontal or lateral violence within the nursing profession. What is horizontal or lateral violence? It is defined as an interpersonal conflict between two or more coworkers at the same hierarchical level within an organization. Horizontal violence is also known as lateral violence, and it commonly occurs in the workplace setting, especially in the nursing profession. According to the Journal of Nursing Management, issues regarding horizontal and lateral violence have been plaguing the nursing profession for more than 3 decades. Who is at risk for experiencing horizontal violence? Well, anyone can experience horizontal violence within the workplace. However, there is a certain demographic that is more at risk. These individuals are newcomers to any work environment, such as recently hired nurses and new graduate nurses. According to research, more than 1/3 of new graduate nurses are victims of horizontal violence. On this slide, we're going to be going over the different types of horizontal violence, which includes psychological, verbal, and physical. Examples of psychological horizontal violence include belittling others, prejudice, and isolation. For example, for isolation, it would be other nurses intentionally leaving a new graduate nurse to fend for herself and not supporting her. Verbal examples include name-calling, insulting, gossiping, or making offensive jokes. Meanwhile, physical examples include pushing, kicking, slapping, or damaging property. The increased prevalence of horizontal violence within the workplace has been linked to a decrease in the physical, mental, and social well-being of nurses. This can manifest as sadness, anxiety, fear, stress, sleeping difficulties, mental fatigue, decreased motivation, and low self-esteem. These negative feelings result in an increase in absenteeism, shift turnover, and thoughts to leave the nursing profession entirely. On this slide, we're going to be examining the effects of horizontal violence on the organization and patients. Horizontal violence negatively affects healthcare organizations by harming the workplace culture, leading to a hostile working environment in which nurses no longer feel supported. This significantly decreases the quality of care and leads to compromised patient safety. There is an increased risk of error when nurses are experiencing stress and anxiety associated with horizontal violence. In addition, isolation in the form of lack of communication and support from other staff members also contributes to a decrease in the quality of care for patients. How can nursing leadership combat horizontal violence? An effective leadership style is necessary to create a healthy work environment that combats horizontal violence. For example, a transformational leadership style is associated with improved working environments, which ultimately leads to improved patient care outcomes because staff members feel supported and empowered. There's also characteristics of effective leadership, which include modeling ethical behaviors for staff, being respectful, and maintaining a caring attitude. Interventions to consider include educating staff on the topic of horizontal violence, encouraging appropriate behaviors that correlate with the organization's code of conduct, and implementing policies that address horizontal violence within the workplace. In conclusion, horizontal violence is also known as lateral violence. It is defined as an interpersonal conflict between two or more coworkers at the same hierarchical level within an organization. There is a high prevalence of horizontal violence within the nursing profession. Types of horizontal violence include psychological, verbal, and physical. Examples of these include isolation, gossip, and hitting or kicking. Horizontal violence negatively affects the physical and mental well-being of nurses and creates a toxic work environment, which ultimately leads to a decrease in the quality of patient care. However, nurse leaders are responsible for establishing an effective leadership style that fosters an environment where nurses feel supported. On this slide is a list of references that I utilized to develop my presentation. And that is the end of my presentation. Thank you so much for watching.